As part of the Community and Clinical Integration Program for the Connecticut State Innovation Models Office, State Innovation Models Program Management Office, Qualidigm is happy to present the Oral Health Integration webinar on primary care for the CSIP. We're very happy to have Dr. Geraldine Weinstein here with us today. Dr. Weinstein is an associate clinical professor at the UConn School of Dental Medicine. She teaches in both the undergraduate and advanced general dentistry programs. Dr. Weinstein also serves as the coordinator for the students enrolled in dual degrees for general dentistry and masters in public health. And Dr. Weinstein has been in academic dentistry for many years, since her graduation from the University of Maryland College of Dental School in 1994. She's the editor of a dental textbook published earlier this year entitled The Dental Reference Manual. She's also pursuing a master's in public health. Among her duties at UConn is to develop educational materials and programs to integrate oral health into primary care practice. All right, like we said, we're very happy to have Dr. Weinstein here with us today. And we're gonna go ahead and pass it over to you.
Thank you so much for that introduction. Thanks for having us here today again. I just wanted to be able to share for a few minutes how excited we are to share our dental world in the hopes of gaining some collaborations and improving care for our patients down the line. Now, our basic objectives are very broad right now with an array of oral health issues to support its integration into medical practices. The presentation was created realizing that you have a lot of different medical practice settings out there, and we're hoping to touch on a few things that hopefully would help you with your patient care. So sharing a few facts, access to dental care has been an ongoing issue in this country. Oral health objectives, as a result, have been integrated into the National Goals for Healthy People for 2020. And there are reasons for this I hope to share with you today. The most important objective is to build a partnership with you. Again, together we can close this gap and make oral health more realistic for our patients. So, a few facts. Tooth decay has been a prevalent problem, chronic condition with a lot of people in the U.S., and it starts with the preschool kids, 3 to 5-year-olds, and there are reasons for that. And we have clinics all across the country that try to make this better, the WIC clinics, where oral health is integrated, and teaching parents, mothers, how to care for their children. And then as you get older, with the elderly over 75, there are a lot of physiologic changes that occur in the body. And so many of these patients are on medications, and it affects their salivary flow. And so as a result, they get a lot more decay. Tooth decay, unfortunately or fortunately, does not cause pain until it becomes extremely extensive. So once it gets extensive, you need more than just a filling. You need an extraction or a root canal. So we have a lot of people. 74% of our adults ages 45 to 64 have lost a tooth because of tooth decay or because of periodontal disease, that's gum disease. And see, for us, simple restorations or a cleaning can be as easy as, not as easy, but around $100 to get that done. But replacing that actual tooth can be anywhere from $1,500 to $2,000. So really we want to get in on prevention and early intervention in dentistry, because that's the only way that we can avoid morbidities of the tooth. So this is quite alarming that a quarter of our elderly, 65 to 74 years old, according to the CDC, have lost their teeth completely. Edentulous patients with dentures can be an issue as they age because a denture is not made to last forever. Changes in the bone of our elderly can affect the fit of the denture in the long run, and this is even true in the absence of osteoporosis. The ability to function is decreased, which may affect their overall nourishment. And then you can think of elderly who have Alzheimer's. misplacing those dentures could be detrimental to their overall well-being. There's simple things like relines and adjustments that can improve the fit of dentures. And when they have good dentures, the elderly can function, so it also helps in their nutrition. But most importantly, we need these elderly to come in, and I'll share this in a little bit, for oral cancer screening. So, untreated dental disease and systemic health. There's a lot of literature out there that links dental disease to systemic health. The anatomy of the head and neck, the lymphatics and fascial spaces allows movement of infection from a localized area in the mouth to becoming a more systemic problem. Think of a brittle diabetic who's prone to infections and has oral conditions such as this, and it could quickly turn into a systemic problem. The best documented systemic problem that's related to dental disease is cardiovascular disease. Any patient who's had a history of cardiovascular problems is always susceptible to endocarditis, especially if the patient has had valve replacement. Our protocols at the health center is that any patient who's undergoing or about to undergo cardiac surgery, joint replacement, chemo or radiation, has to have a dental evaluation prior to surgery. And this really decreases the post-operative problems that they may have after the surgery. When we think about oral care in pregnancies, as I had mentioned before, our young children have a lot of decay, ages 3 to 5 years old. And this is pretty much related to the fact that we need to educate our mothers out there. We can't have them putting the baby to bed with a bottle containing juices, containing milk, anything like that. Oral hygiene is essential. And the other important thing is really strep mutans, which causes decay in the mother, is highly transmissible to the child. So controlling bacterial counts, controlling the hygiene of the mother, controlling her decay is essential to having better oral health care for the child as well. As an example, our pediatric dental clinics here at the Children's Hospital in Hartford has a waiting list that's months long in treating these children that have baby bottle caries. And it's really horrible that a child would have to go to the OR for a few hours to get their teeth out. It's completely avoidable, and we really need your help in avoiding this epidemic in young children. So, moving on to a different field, oropharyngeal cancers, only a third of it are actually detected early. And these cancers can be very aggressive. In the past, surgical removal of these tumors would cause large disfigurement of the patient. However, with modern technology and early detection, we can spare the patient large resections. Utilization of dental services is below 50% for all age groups in the USA. And I'm hoping that because patients come in to see their physicians, come into primary care more often, we could actually work something out so that you're actually doing some sort of screening for oropharyngeal cancers and having them referred appropriately. I will share with you some materials later on how we can do this and how we can integrate this into your primary care setting. Head and neck screening is especially important in our elderly population. The incidence of oral cancer increases over time as you go from ages 50 to ages 80. And this is obviously much greater in patients that have had a history of use of tobacco and alcohol. The other age group that's been increasing in frequency as well is our young adults, ages 30 to 39. And I will share with you that a lot of these cancers are related to the HPV vaccine, HPV virus. And so the American Dental Association has taken a stand in really trying to work with everyone to try to get our young adults given the HPV vaccine. So it goes without saying, poverty and untreated dental disease is linked. We're fortunate in Connecticut, however, that Medicaid has provisions for emergency dental care and treatment. Medicaid in Connecticut extends beyond extraction and to yearly prophylaxis and restorative care of teeth. So while we have a dental school here in Farmington, if it's not accessible to your patients, we have many community centers throughout the state that can provide treatment for Medicaid patients or give it at a reduced cost if they're not eligible for Medicaid. So the lack of access to routine dental care has increased the emergency room visits by those who do not have a dental home. And we're seeing this trend all across the U.S. Emergency rooms and hospitals are really a place for palliative treatment. Oftentimes pain medication and antibiotics are prescribed, but no treatment is actually rendered. And so the cause of their dental infection is not actually addressed, and it can recur shortly. Patients do need the dental home to avoid these situations. We want to decrease visits to the emergency room by these patients and really just have them into our clinics for regular dental care. And this is a sad but true story. A child, the Amont driver in Maryland, happened in the early 2000s. Presented via the emergency room with a significant tooth abscess, which quickly became a cellulitis. Now, the infected tooth generated so much pus that it extended to the facial spaces of the brain. And they show him here with a picture of a scar because they had to do a drainage twice, 2 surgeries. He was admitted and treated at Maryland's Children's Hospital, and even modern medicine couldn't save him from his tooth abscess that had gone too far. We don't want incidents like this to be a catalyst for change. We're here today to seek partnerships with you in primary care to improve care for your patients and to improve care for the citizens of Connecticut. We can't let this happen here. So here's a slide directly from a dental company showing you the other side of the coin. We can save a lot of money in the long run. If we treat dental disease before it becomes a problem, we can actually avoid costly medical procedures. So what can we do in a primary care setting? We can deliver very basic services. We have some pediatric practices out there that are already putting fluoride varnishes on children, and I'll show you that in a few slides down. We can do basic oral health screening, and we can do screening for oral cancers. And certainly we can do referral of patients to a dental home. And I'll get you some more of this information. But the other thing I wanted to share with you is there are Medicaid billing codes that are established for non-dentists to use in primary care settings. And we share this with you so that we can envision how these encounters could be structured. As I said, Medicaid in Connecticut is extremely generous compared to other states of the country. Here in Connecticut, we do diagnostic services, we do preventive services, we fill teeth, we take teeth out when we have to, and we also replace teeth, which is important for the elderly or people who lose their teeth so that they can continue to function and have good diets. So I'm going to go into what we can do for you at UConn Dental to help you establish a protocol for oral health integration into your primary practice. So one of the basic things the American Dental Association does and encourages for all dental practices is do risk assessments. And we can certainly tailor these risk assessments for you in your practices so that you can use it. to properly counsel your patients and determine interventions that are appropriate for each of our patients. I'm going to close up on this here. Yeah. Take a look at the high-risk category. There's certainly patients who need a dental home yesterday, particularly those who experience dry mouth or xerostonia, as these may be medication-induced or perhaps a history of chemo or radiation therapy. And then we have patients with high sugar diet. If a patient is obese, we can coordinate with your dietitian to do oral health and nutritional interventions. And we have a number of patients, as I said, we need to work with you, because treatment of their dental disease can only be possible if their medical issue is controlled. And some of these examples are patients that have drug or alcohol abuse, patients who have a lot of acid in their mouth, like patients who have bulimia or patients who have GERD. These are patients that we need to make sure their medical issues are controlled before we can move forward to do their dental work. An oral health risk assessment is a great way to train clinicians to recognize red flags for patients that need urgent dental care so that they can be properly referred. It's also a great way to document that actual oral exams were performed during the patient's visit. So other ways we can help you with is do training for oral cancer screenings, perhaps integrate into your yearly physicals that the patients get, and we can provide you with easy-to-read guides to follow along and pictures, for instance, that you can see and how to do it. Oral health screening, again, is very important for our elderly patients. So we can do this with anyone on the staff. It's certainly not limited to the physicians. This is something that the nurse practitioner can do. This is something that can be done by the physician's assistant. We just need someone to look and see and document and then refer the patient appropriately. So as I had mentioned earlier with the HPV vaccine, the HPV vaccine has a really bad stigma, and it's for the young adults and for the parents of young adults or teenagers. They think of it as something for people that are sexually active. Well, we have found that HPV-16 has been linked to a number of oropharyngeal cancers. So for this reason, the American Dental Association is totally supportive of the CDC recommendations. The vaccine can protect the young individual from HPV infections and protect them from developing HPV-related cancers later on in life. We have that growing incidence of oral cancers in young adults ages 30 to 36, and so it's really a good reason to advocate for the HPV vaccine. As I mentioned earlier, we can show you how to do fluoride applications. It's very simple. It comes out of a unit dose dispenser with a little brush, and it can be applied on the teeth. There are billing codes for non-dentists to apply fluoride on the teeth. This is being done in pediatric practices across the state, but I really would like to see this being done in adult practices as well. We have a lot of patients who have higher risk of decay, and they could really benefit from getting fluoride on the teeth to prevent decay that could lead to problems later on. So I'd love to be able to work with the dietitian as well. Having good oral care, having a good functioning mouth is essential to eat fruits, vegetables, anything that's good in your life. And so we'd really love to help you get these patients with functioning teeth, whether it's dentures or it's their own teeth. It's essential to get their mouth in order. So the other thing we can do is we can provide educational materials that are essential for your patients to have. It's important that these materials are culturally competent to reach its intended audience. So we have the ability to provide them in different languages, especially in Spanish. Pathways for referral for dental treatment. We are here in Farmington, and we take all patients. And there are different ways to see patients. We have our student clinics, and we have our faculty clinics. We provide care for Medicaid. We provide special needs care as well and accept Medicaid and other insurances. But certainly there are other ways of getting care that may be more convenient to our patients. And we have that in the Connecticut Dental Health Partnership that could get you more information with that. Really, thank you for your attention. I do have a few questions. We're just trying to get an idea of where we are with the groups that have joined us today. So if you don't mind answering these questions in the chat box. Can you integrate an oral exam in your annual physicals, and do you have any suggestions on how to do so? So the other question I have is, do you have an established referral path for patients that need dental care? And if there are any questions from the presentation, I will be happy to answer them. You could unmute pressing *6, or I can start reading off from the chat box here.
All right, so I just noticed that there's nothing in the chat yet. If some of you aren't comfortable putting it in the chat as you're identified, and maybe you want to keep some of that internal, we can send out from Qualidigm an anonymous survey because we feel like some of this information is important to know.
Hey, Connor?
Yeah.
Connor, this is Adriana. I'll just jump in. I did type in a question in the chat box. So one of the question that I have is if the presenter knows of any clinics where sealants are applied in a medical exam room, and I'll give some background in that. So obviously providing sealants is really important, and it's one of our UDS measures and just goes to overall preventative dental care. And one of our dental staff was trying to think of a way that we can make providing sealants, or applying sealants rather, much easier and not requiring the patient to go into the dental exam room. Like if we're able to go into the medical room and meet them there if we see that there's a patient who's in need of one. The challenge that they've faced while exploring this out of the box idea is that you need to be able to dry off the tooth. And so we were just curious to know if the presenter is aware of anyone else who's applying sealants in a medical exam room outside of the dental exam room.
Hi, Adriana. This is Geraldine Weinstein. So I don't know. I would have to check with our pediatric groups to see if there's anyone doing that in the medical field. It's not impossible because whenever we do like outreach programs in the schools, we have certain things that we can use to dry the tooth off and apply sealants there. So it's not impossible.
So maybe I can contact you offline to get some further information about that, because we would love to learn about that.
Sure, absolutely.
Great.
You could, should we put my email in there?
Absolutely.
Phone number? We're going to put my email and phone number in the chat box. If anyone needs to contact me for anything, please feel free to do so.
Thank you.
And Megan and I can follow up as well with that contact information. And what we were saying is that to answer some of Dr. Weinstein's questions, we can send an anonymous survey monkey out with those questions. If you would like to answer that, contribute some information, but don't want to kind of do it in this open forum, we understand that.
Thank you so much.
All right, we also did have a question.
Yeah.
Can you go into a little more detail about what is a dental home and where they may be located in Connecticut?
Okay. So a dental home is really having a dentist you go to for regular checkups, whether they determine not to be every 6 months, every 4 months, or every year. Get your fillings done, your cleanings done on a regular basis. And so here at the dental school, we have many ways of doing that. So you could have a student dentist taking care of all your teeth, or you could have faculty taking all of your teeth. The difference being is if you have faculty, that's your person forever. And if you have the student, that student may change as they move on. And it also changes the fees of the provider depending on who you see.
Awesome, thank you.
Does that make sense?
Yeah.
Yeah. Different from private practice. I mean, certainly our student programs are a lot less expensive than going to a private practice. Just takes a little more time.
Great, thank you. So, does anyone else have questions? You can either unmute and ask kind of through the phone, put them in the chat box, whatever works for you. We'll wait a few more minutes and see what people are wondering. Okay, we'll give it 2 more minutes, and then if we finish around 1/4 of, everybody, gets time back in their day. But please, if you have anything else you're wondering, go ahead and ask. Okay, well, it doesn't look like anybody has any questions today, but we all now have Dr. Weinstein's contact information, and Megan and I will make sure that it gets out to everybody. This recording will be available on the CSIP LMS. We'll notify everybody when it's put up there, but I wanted to thank Dr. Weinstein and the UConn School of Dental Medicine for taking the time to speak with us today. We really appreciate it and found it very interesting. So thanks, everybody.
Thank you. Have a great one.
You too.
Bye.
Bye-bye.